Security personnel at the Rethabile Clinic in Polokwane have denied selling masks to patients. This follows alleged reports that government allocated free face masks that are being misappropriated. We're joined by the Limpopo Health MEC, Phophi Ramathuba, who recently visited the facility unannounced. Ma'am, thank you very much for your time. What informed your visit to the clinic?
Afternoon to all you viewers out there. I think firstly, unannounced visit is one of the ways that I've introduced in terms of monitoring service to the people, what people always complain about. So usually whenever we get complaints, it assists us, even when we do this announced visit, that we know which area to target and which facilities to prioritize. So Rethabile Health Center is one of the facilities that I've received several complaints, including the fact that while the patients do understand that yes, there is a case in terms of when the nurses request that every patient should be able to wear a mask, they are very worried about those who do not have mask are then directed by security to buy the mask, and the allegations were saying the very same securities are providing the mask, and according to them, the allegations, you can't say this is the stock that they are providing or it's coming from us because they are not marked. It's the same mask that we are utilizing. So that is why when I arrived, I had to really first find out what would be the reason for not allowing a sick patient because they don't have a mask. Now, in terms of the nurses, their explanation made sense to say, look, after the relaxation of the mask by the president, they then recently started to see a spike in terms of the new TB infections, including MDR, especially of their own chronic patients who are diabetic, who are on ARVs, but they're starting to present with TB. Now they got worried to say, are they not infected or infecting each other when they come to visit facility? Hence, they then introduced to say, let's go back to the issue of the mask so that we're not seen as discriminating other patients, say, you because you should wear a mask, so all patients wear masks. However, the nurses then indicated to me that they do give security a box, which the security are supposed to give to a patient who comes without a mask and not deny them access. It's only probably those who are visitors that maybe we could be strong, so we can't sustain providing mask to visitors and all those other people. But patients, even the law, even in our facility hospitals, we are supposed to provide them with masks. Then the challenge was what is happening to the boxes that the nurses are giving to the security guards. There were quite a number of stories that were raised, but I've referred the matter to our risk and security management so that thorough investigations on these allegations can be cleared. I was shown the ladies who sell the mask to say they are not necessary securities, they are street vendors, but they still, we cannot conclude that the masks that are being sold out there, especially with the exorbitant price between 5 rand and 8 rand. You're talking about patients who visit clinics because they don't have access to funds where they can go to hospitals or to even go to private facilities. PHC services are supposed to be free, so we can't start selling masks to people that we've already declared that they can't afford and they cannot pay. What we have agreed was that while all the
join you for the purpose of time, unfortunately. So while that investigation is ongoing to determine who these people are, whether they are employees of the hospital and whether these were masks that were provided by government, we also understand that there were pregnant women who were not attended to for hours on end because the staff were merely not interested doing their own thing. What transpired from that, and what is your understanding of what happened, and what are the consequences if indeed this did happen?
The reality is that Rethabile Health Center does not have management that inspire the confidence to me and also to the public. While generally there's this issue of shortages, what I saw in Rethabile is perceived shortage. If you have got 4 midwives and you have got those patients that were there were probably 9 pregnant women who are here for antenatal clinic, and then you are told we had a delivery and it was only 1 delivery from 7 o'clock to 1:30. So when you look at the workload that they were complaining about, it does not make sense. And the midwife who's supposed to be their supervisor indicate to me that she's in the office. She doesn't count herself as being operational. And for me, I was saying, the reason we appoint you as an operational manager who's a midwife to supervise other midwives is because when there's a crisis, you must be able to go in and help. And I don't think there was a crisis that day. There was just an issue of attitude. There's just an issue of what we are dealing with on a daily basis, of failure to get a public servant who would understand exactly what it means to be a public servant. So yes, it's not only that, even those who are opening the files, the lady who's supposed to supervise those who are opening the files, she's the first one to go on lunch when she see that there's overcrowding, there's a challenge, patients are there, they're not being attended to. You go to consulting room, you find doctors are waiting for patients to open the files, and the turnaround time, it's just not working. You then look at the help desk, it doesn't really exist. The management is sitting there in their own offices. They only picked up that the MEC is around when they start to hear that there's really a chaos in casualty, and that's when they are able to come in. So management must understand that in the hospital facility or in the health sector, you can never manage by sitting in the office. You must manage by working around and pick up these problems and resolve and attend to them immediately. So you cannot wait for the MEC to come from head office to come and pick up the challenges. So that in itself does not inspire confidence. And I think consequence management will definitely have the district manager and the HOD and the DDGs. I can't comment about those because tomorrow I'll be accused of running to the media. But the reality of the matter is that facility needs an entire overhaul in terms of its management, because if you do not have the management that inspire confidence, don't expect the workers to do the work. If you are a chief registry clerk to supervise the opening of the files, you are the first one to go on lunch. You should be the last one to go on lunch after you have made sure that you have cleared the crisis. If you are an operational manager or a clinic manager, you must be able to put systems in place that addresses the challenges. And before you start complaining about resources, we've got to do our part. So I think we will be helping that facility. We're taking responsibility as the department. And if you go there these past 2 days, which I've been trying to monitor, I've realized that the things have changed. They're starting to improve. But we think that's not the way how the department must function or run.
MEC Ramathuba, in these past 2 days, while it is welcome that, they would pick up their socks, the reality is that this nonchalant attitude by some public health officials is far widespread, right? And so you speak of completely overhauling Rethabile. Can you give us timelines in terms of when the people of that community can expect to get people who, A, actually show up for them and do what they need to do for them, and B, to ensure that the community is actually serviced? This is a public clinic, and if people are not able to get the private option, this is their first point of call. If they don't get that, that's a violation of their basic human right.
What I can indicate, we've already started. That's why you see all these changes that have started. As I've indicated, these are some of the issues that I cannot go and address on the media because they will involve labor relations matters. And I'm the appeals authority. Whenever the HOD would have finalized whatever she's doing, at the end of the day, every employee must still come back to me for an appeal. It doesn't matter what the outcome is. So I would not want to dwell much on that to say, let's protect that process. Tomorrow we will be taken for arbitration for CCNA to say the MEC was playing to the media color. Allow the HOD to deal with the administrative process. What I can reassure the people is that we have already started. That is why there is improvement. And on a daily basis, there's somebody whom they don't even know who the person is. who does go there and check and see if indeed the people are still expected to buy the mask, who is selling that. So that work is there. And I can reassure you, if I visit a facility and find challenges, we usually want to start immediately on the very same day that we start with the turnaround, implement it, and while the other processes will be continuing, but services must continue to function without being disrupted.
MEC Phophi Ramathuba with the Limpopo Health Department. Thank you very much, ma'am, for your time this afternoon.